department has a new managed care organization to serve individuals for Medicaid expansion. So Blue Cross Blue Shield North Dakota took on that role as of January 1st. So they're brand new at it. And you're all aware that the 1915I does serve both non-expansion and expansion clients. So we've been meeting with Blue Cross Blue Shield North Dakota for quite some time, trying to get everything in order for the big start date. So we've invited Tracy Moen to provide us with information on the 1915I for expansion individuals. So with that, we will get started with Tracy.
Thank you, Dawn. I just first want to kind of give a little introduction to who I am. Like Dawn said, I'm Tracy Moen. I'm our manager of our utilization management team, but under that includes our behavioral health providers or behavioral health services, as well as our case management for behavioral health. And I'm just really excited to join in these groups and try to kind of work through the 1959 as we start taking care of this. I do believe a lot in the services that are provided. A little prior history for me is prior to working at Blue Cross Blue Shield in North Dakota. I've had multiple different roles, case management in an outpatient setting, working with patients with dual diagnoses. I've worked inpatient primary care clinics, as well as partial hospitalization programs. So I've had a wide variety of experience, but I also learned that with every day I learned a little bit more. So welcome learning from you guys also as we go along this journey. So Medicaid expansion, as you guys know, and Dawn just had mentioned, is that the North Dakota Department of Human Services has allowed us to start serving this population as of 1/1 of this year. It's been an interesting start as we continue to work and grow with our providers. We will be administering these benefits. It's a 4-year contract with a possibility of a extension if needed. So the couple things that I wanted to talk to this group about is some of the ways to be able to get information about Blue Cross Blue Shield in North Dakota to aid in the assistance of pre-authorizations, as well as submitting claims, getting remits for payment. And one of the big things that we really look at is our provider manual. So we do have a provider manual, and this manual is actually for any provider at Blue Cross Blue Shield North Dakota, but there's specialized sections in it about 1915I. And if you go to our Blue Cross Blue Shield website, you're able to read that provider manual. And I actually reference it on a fairly regular basis. Also, if I'm looking at, how does someone do a claim adjustment or different information about how to submit a request. And so I want to make sure that you knew that that information was available to you at that provider manual. It's also updated on a regular basis. And so we try to keep it as a living, breathing document so that we can add updates to that. There's also another way that we communicate with our providers, and that's through our healthcare news system. What healthcare news has on that, I apologize, I think my slides are going a little quicker than I wanted it to. We also update through our healthcare news system, and we'll come back to that in shortly. So there's also a Medicaid expansion provider website. And on that, it also talks about 1915I and the providers. One of the things that I most often get a question about is there a separate credentialing for Blue Cross Blue Shield in North Dakota? And we are actually partnering with the state of North Dakota. So if you are credentialed with the state of North Dakota, you'll also be credentialed for us. The other question I oftentimes get is how do we submit claims or how do we submit requests? And these are questions I get from many different providers, not just our 1915I. And the way that we do this is through our Availity portal. And so we have an Availity portal, which is a partnership to do electronic data exchange, and it's actually multi-payer. And so when you go on to that and you register for that, you'll register for Blue Cross Blue Shield in North Dakota. I wanted to mention that because some of our other providers may work with other insurance plans in other states. There is the option to also go and sign up to go to Blue Cross Blue Shield in Minnesota, but you'll be utilizing the Blue Cross in North Dakota. Some of the things that the provider provides to you is being able to check eligibility and benefits. We do those searches by first name, last name, and date of birth. We do add the date of birth in there just to make sure that if there's two John Smiths, John Smith Jr. and Senior, that we make sure we give you the benefits for the correct member. There's through this availability, it's also one-stop shop where you can submit claims and review the status of those claims. And so you're able to check back to see, has that claim been received? Have we been able to submit the remit on that? Also, if for some reason you make an error in a claim, maybe you wanted to put 4 units for something and you accidentally put 3 units in it, through Availity, you can correct and void that claim if needed. Also, when you're requesting pre-certifications, our 1959 services require pre-certification. On that same Availity portal, you're able to submit that request, and it's similar to, in one way, kind of like a texting. Once you've sent us a request, we'll send information back to you through the same portal, and you'll be able to communicate back and forth. We are always willing to have those phone calls also, but that portal just allows you to be able to check on the status of those pre-certs. You could also look for your payments in there, and there's direct messaging. So if you have a question regarding a member, you could also send that through there, and then we'll also respond through there. So how do you sign up for Availity? So on the Blue Cross provider page, there is a section that says log into Availity. By clicking that, you could just follow the prompts there to sign in for Availity. One of the things to know, if your facility is a current user, because maybe you provide additional services and you're already on Availity, or if you're a new user, there is an Availity provider training, and that's in our healthcare news area. So we'll talk a little bit more about that in just a minute, but there is training available there, but also there's direct questions if you have, or emails that you can submit to our Availity services. Before I leave Availity, I just want to open it up to see if anyone has any questions about Availity or our provider portal.
Tracy, I did just add in the comments, this is Monica, that those, you had mentioned the pre-certifications would be entered in Availity. And just so everybody is clear that that's the same as our service authorizations that we enter in MMIS. Yes, thank you.
So we're not able to do any authorizations until we've been an approved provider within Availity, right?
Well, what you can do, and our goal is for everyone to go through Availity because it really is a one-stop shop for being able to submitting claims as well as pre-certs. If you are signing up for Availity right now and you have not gotten in yet, you could also fax us a request and we can look at that with the ultimate goal that we want everyone signed up for Availity because it's much easier to be able to get that communication on a quick, timely basis versus coming through the fax and manually entering.
But we do have to, we have to register our organization first.
In the meantime, while you're going through those steps, if you have someone that needs services right now, we don't want to delay care. Okay. So then I would fax it to us.
Okay.
However, the ultimate goal is that we have it through this portal as our long-term solution.
Absolutely. So what would I fax over? And maybe Monica can help too.
Yep. So what you would fax over, there is a provider form on our Blue Cross Blue Shield page for outpatient services. You would complete that with your information, your MPI number, who's going to be performing the services, and then the codes that you want. Because I know that there are certain, care coordinator codes, and there's codes for, for peer support. So the codes that you want. We will then look at that, and the clinical documentation I'd add in is that care coordinator report, if you have that, or if you've had a previous authorization from a different plan, please include that so that we know what's been authorized before, because we do want to honor those previous authorizations.
Okay, and the fax number will probably be on that provider form?
Yep, it's on the provider form.
Perfect, thank you.
Any other questions?
I'd just like to add a little clarity. I know that community options, they're like our front runner. They have become our most knowledgeable provider at this point. So for the benefit of the others, just a reminder, we will share providers between the state and Blue Cross Blue Shield. So nothing is different. You're going to enroll as a provider with North Dakota Medicaid provider enrollment. Everything's the same. The only time what we're talking about here today applies is if you are wanting to serve an eligible expansion client. Mm-hmm. That's when things kind of change. So you may have already known this, but I just wanted to clarify in case people weren't grasping that. Thank you.
Yep, and our goal is that our process will be similar to what the state does, because we don't want you to have to do something different for traditional Medicaid versus us. But the avenue to get information to us would be through our Availity portal, or while you're in the process of signing up, being able to fax. Any other questions? Nope. Okay. So the next section I wanted to talk about, we talked a little bit about the provider manual, which is updated. That really it's a very large, lengthy document that kind of gives you the how-to and the whys and wheres of, kind of working with Blue Cross Blue Shield in North Dakota in general. But we also want to make sure that we have regular communications on different things that happen. And so what we do have is a healthcare news system. And basically what that is, it's an electronic newsletter that we publish and send out to providers that kind of gives you helpful tips, things that have changed. If we're having any difficulties, with someone being able to access something, we might write a healthcare news so people have that ability to, know what's going on. And so we do that healthcare news. It's an easy way to be able to communicate back and forth. So if you do want to sign up for our healthcare news, which I highly encourage any provider to do so, again, on that Blue Cross Blue Shield provider page, there's a subscribe to providers news. And you can actually subscribe yourself. You could have multiple people in your organization subscribe. I personally subscribe, even though I look at the healthcare news articles before they get sent out, just because I'd like to know when that notification went out and be able to reference it later. When you go to healthcare news, you can also look at old articles. And with that, I went through some of our healthcare news recently that might be helpful to this provider group. And if you look at the screen that we have right now, in June, we did some Availity pre-certification tips, so that once you're signed up and logged into Availity, it kind of gives some tips on how to be able to navigate through those systems. We also talk a little bit in our July article about the provider claim submission, the claims tool that's in Availity, as well in August is our provider direct messaging, and then our claim correction notice. And so it really is, if we get a lot of questions from providers or if there's a change to our system, we will send out this healthcare news for all providers. And when you receive it, what you'll do is you kind of get to see the headlines in the email. And so there may be things that pertain to you guys, and there may be things that don't pertain. On the ones that pertain, those are the ones you open up and you'll be able to see those or utilize those. Or, if you know that you've read one and you wondered, I can't remember where I had read that before, we do have a search function that you can actually put in the word Availity, and all the Availity articles will come up. Questions on our healthcare news? Okay. So the other thing I wanted to talk about is a service that you may or may not utilize, and that's our Blue Cross Blue Shield case management. This is separate from what your care coordinators do or your individual 1959 providers. Our case management program is a voluntary program that is telephonic, which can add added support to our members. And again, it has to be based on the member's approval. But if they want to, our case managers will reach out to them however often it's needed to kind of work through some personalized goals. We can make those referrals to case management through the number that's listed here, and we would reach out to those members. So you may be wondering, who do you refer to case management? In this slide, we really did develop for all our providers. So sometimes we get referrals on people that have gaps in care. So for example, maybe you're looking for a provider that's participating and you need help in trying to find a provider. We will get referrals through our case management team in order to kind of help find those providers. It might be have individuals that are transitioning from a higher level of care to a lower level of care, or maybe they're looking to go into a residential care or something like that. Our case managers are more than happy to assist with that, as well as social determinants in health. Where I think it really will connect with our 1915I providers is we're going to try, once an individual has been deemed eligible from the zone, prior to them initiating with a care coordinator, trying to connect with those members to help them get to that first appointment. Once they've gotten into that first appointment, oftentimes the case may be closed because you guys will be providing a lot of those services, and so we don't want to overwhelm the member, but we do want to help to be able to get those individuals into care, get them to those appointments if needed. The other thing that you might get from our case management team is they're working with our current members. If they find an individual that maybe really could qualify for 1959 services, they might be providing educations to them, helping them to assist to meet with the zones in order to look to see if they would qualify for those services. Any questions on case management?
I just put kudos to Blue Cross Blue Shield North Dakota for offering that. That is going to be so helpful. So thank you very much, Tracy, for all you guys have done to make this program the best it can be.
Thank you. And I really appreciate your guys' feedback. If you guys have things that we could do to be better, we would definitely want to hear that, or things that we could do to help ease the process. We want to have that collaborative relationship. I do believe that the services that can be offered under 1959 can really help improve our members' lives. And so we really want to be able to partner along with you during this process. I think we'll learn things as long as we along the road, but really open to that feedback.
So Tracy, when the person is approved in our eligibility system, how will you know that they're approved? Like, so that your team can reach out to them for the case management piece?
Yep, we're working through getting a secure file transfer, and on that file transfer, it'll say who's been recently enrolled and if they've been connected or not. And so if we see someone's been enrolled, we'll do a phone contact and a welcome letter out to that member to see if we can engage them and help them get to that next appointment.
Okay, so I'm wondering then if we should be watching that as far as Jennifer's activities, so that she's not in addition reaching out to those members who are an expansion. Okay.
Yep.
And that report, we're calling it a report. Tracy referred to it as a file. That is going to be, the department initiates that, and Blue Cross has the ability to pull that report every day.
Oh, okay.
So
Yep.
we can talk more about that at our next meeting too, guys.
Thank you.
And I'll, bring our case managers into those meetings. And I think, as we work through it, as you mentioned, that you have a role that's currently doing a lot of that work.
Mm-hmm.
I see that we would have a lot of collaboration back and forth on, how to do that, who takes which members, how do we assist each other.
Yes. Thank you.
You're welcome. One of the last slides I have here is just some helpful numbers and contact information. It provides, what our provider and member service phone number is. And as you can see, it's the same number. And so depending on, what you call there, you'll either go to our provider services or our member services. There's the phone number and the email for our Availity provider portal. And you can ask any questions about the process as you're signing up for Availity. If you run into questions or concerns there, feel free to reach out to me and I'll try to help facilitate. Our behavioral health line and our line, those are two numbers that you can call if for some reason you've submitted a pre-certification, you haven't heard back, feel free to reach out to them. They can assist in looking to make sure that we have the information we need and that we can get back to you in a timely manner. And then, of course, the case management, which we just talked about. We're always open to those referrals. And if a member consents to that service, we are happy to do that. Our goal is not to duplicate the services that you are currently providing. You guys are experts in the field, and we want to honor that. But we also want to be able to provide that service to help individuals get to that next level of care. Also, one number I didn't list on here, but I think I've given it in these other technical calls also. Feel free to reach out to me. You can call me directly through my line, or you can email me. My direct phone line is 701-277-2787. If you want to email me, you can email me at Tracy, tracy.mohn, M-O-H-N, @bcbsnd.com. My only request, of course, is if you email at me that we don't have member information, because we do want to protect the confidentiality of it. But a general question, even that you need me to follow up with you, that would work also. In closing, any questions or concerns or any problems that you've run into starting this process? I know that we're only on day 12, but I'm very open to any feedback.
And you certainly aren't expected to remember all of this.
Yes.
We're all learning as we go, and we have contact information on the 1915I website too, which I just included in the chat. So whenever you have questions, Tracy's very available, and so are Monica, myself, and Melissa.
So one more question. When I fax over that provider form, and this is maybe a question for Monica as well, we still have to attach that plan of care supporting the units that we're wanting to authorize, correct?
That is correct.
Okay.
And I think it would be a good time for us to share. We did do a process flow chart for service auths, because it's going to be, and plan of cares. So it's going to be very important, the communication, because like Tracy said, we want to honor what is already happening for those clients who switch back and forth between expansion and traditional, which we call non-expansion. So we are all going to have to work together, and just communication is key.
Will that flow chart be on the website, Dawn?
Yes, and I am going to take a peek at it and just make sure we don't refer to our old MCO and do any updates. And then, so it will be updated. It's on there right now, and we will make sure that it's totally updated by the end of the week, okay? Do you want me to put the link in the chat?
Sure.
Okay.
That'd be great. Thank you.
It'll take me a minute to find it, so carry on.
Any other questions or comments, feedback for us as we're starting this, January 1st?
Well, Tracy, that was wonderful. It was very informative, and you have a good PowerPoint. When we have questions, we can refer to it. You made it very clear you're very invested and welcome questions. So